Hey guys, hoping to make up for our technical difficulties earlier this morning. Please forgive my very low budget film here. I am a one-person production crew, so I'm just going to start with that. But I just wanted to give you a couple tips and reiterate things that are in your PowerPoint and on Dawn's video. So first, before I enter my patient's room, I want to make sure I check the order, make sure I know what kind of dressing the doctor has ordered and what they want us to clean it with. For your orders, it's going to be normal saline and a dry dressing. So I'm going to knock on my door, come in, introduce myself. Before you put your stuff down, you want to wipe down your bedside table, making sure you let this sit for at least 4 minutes, so it has to stay wet for 4 minutes. Don't try to dry it. This is a good time to ask your patient their name and date of birth and if they have any allergies. And then the next thing you want to do is raise your patient's bed and your bedside table so that they are at waist height or higher. So make sure you put down your side rail. You don't want to be bending over a sterile field ever. Obviously my dining room table is not at waist height, so I'm going to kind of probably sit to do this, but I would be standing. So I'm gonna wash my hands. Whoa. And yes, I did have that giant bottle of hand sanitizer before this. I'm gonna get all of my supplies over here. Okay, so when that is dry, I'm going to put on clean gloves. Oops. And this is really sticky, so my gloves are sticking to my hands. You want to take a look at your patient. So I love my lovely patient over here. Check what their pain is. Make sure that you have pre-medicated them if they are having pain. You want to see if there's any drainage outside of the dressing. And then you're going to gently lift up the tape. Keep in mind that some people are more sensitive to tape than others, and you don't want to just rip it off. This is just paper, remember, very low budget film. So I'm going to check out the drainage. I have a moderate amount of sanguineous drainage there. I'm going to throw that in a biohazard bag, which I'm just going to put on the floor for now. I'm going to check my incision. It's well approximated. It has 15 staples. I'm also going to either measure it or I can approximate, but making sure you're not actually touching the wound here. So you're going to just hold your measuring tape a little bit like that. And so this is about 14 centimeters. All right. Now I can take off my gloves. If I have hand sanitizer available, I'm going to wash my hands at this point. If I don't, it's okay. And I'm going to come back down here. All right. I'm going to open my sterile gloves. I like to bend this part down and the top. Kind of flatten it out as best you can. And then open it like this, only touching this outside part, and tent it. So what I mean by that is you want to flatten it out so that it doesn't flop over. Because once you open it, you have touched all of these outside corners. And if it flops over, then your field is no longer sterile. So make sure that it's really flat and it's not going to flop over on you, okay? So then I can start opening my dressings, and I'm going to do it away from my sterile field. And like Miss Ivanko said, keep your elbows in. I like to tell my students to use their T-Rex arms. So you don't want to be leaning over your sterile field at any point. Try not to really breathe on your sterile field also. So you can open these and then you just drop them on. I like to try to stay on one side so that I have a clear access to my sterile glove when I need to put it on. So I'm gonna stay on the right side over here. So at about 6 inches, you're just dropping those on, making sure that they don't touch this outside 1-inch border. If they do, and you're in eval or in simulation at any point, you just say, I broke sterile field, I would get new stuff, and then we'll just let you continue. In real life, you would get new stuff because you've broken your sterile field. Alright, so I'm gonna toss my trash. And I like to put my sterile field as close to my patient as I can get it. So I put my table at the head of the bed, right next to my patient, and I'll put my sterile field right on the edge of that bed so that I don't have to be moving all the way over. You want to make sure that your sterile field is always within your eyesight and you're never turning your back on it. So be careful about that. And then this one, I'm just going to peel back carefully, making sure it stays on the paper. And you can do that as long as you're not touching it. And then put that right here. So before I put my sterile gloves on, I'm going to check my normal saline bottle. Make sure that it is not expired. If it's been opened, make sure that it has the patient's or the person who opened its initials with their time and their date. It's only good for 24 hours. So if it's been more than 24 hours, just get a new one. If it's been opened, you want to open the bottle and pour a little out so you clean the edge. It's called lipping the bottle. If it has not been opened, if this is a brand new bottle, you can just loosen it and leave the cap on just like that. For this purposes, I'm gonna leave it closed because obviously I don't wanna get my table wet. So now I'm ready to put my gloves on. So you're going to grab the cuff with your unsterile hand, lift it up, and you want to put your gloves on kind of down. You don't want to do it like this and then risk it flopping over. I like to do it, I'm gonna stand up a little bit. So you can even pull this away from your table if you need a little bit of room. And then grab this and just pull it down. It doesn't have to go all the way down. It doesn't have to be straight. Just leave it like that. And then once I have my hands sterile, I can move my dressings over here, making sure I'm staying within my 1-inch border. And then keeping my little T-Rex arm over here, I'm going to put all 4 of my fingers inside of this cuff, pick it up, and then fly my thumb away. So I don't want to be holding it like this when I'm putting my hand in because then I'm risking touching my other hand with my sterile glove. So I'm going to fly that hand away. I'm going to put this glove on, making sure that you're staying in there and you're not touching your arm. And then you just kind of flip it off. Don't try to be crazy with it and get it perfect because then you will probably contaminate your field. So now I can fix these if I want. I can touch stuff, making sure that my hands are above my waist. I never want to drop my hands below my waist at this point. So I've already checked my patient, so I'm going to contaminate my non-dominant hand. And I'm going to take my 2x2 over the trash. You're going to pour this on and clean from top to bottom or from distal to proximal if it's coming towards you. And then you get rid of that one. And then we're going to do it again. There we go. Over a trash. And then you're going to do the side away, get rid of that. And then this one, doing your closer side. And you want to make sure that your fingers are not actually touching your patient. Even though you're cleaning them and whatever bacteria they have on them, they already have it with them, so you're not introducing anything. You just want to try to keep your fingers underneath the gauze so that they're staying clean. So then that goes away. With my still sterile hand, I'm going to put these two on, making sure not to touch my patient's skin. And then I can drop my ABD right on top. Once this is on, I don't have to be sterile anymore. So I can use both hands to get my tape. This is 2-inch paper tape. I prefer 1-inch, but this is all I had. So you want to make sure you're doing a window pane type tape. And you want to use the least amount of tape that you can. If your patient has super sensitive skin, you can also use a skin prep, which helps to protect the skin against the tape. So for your elderly patients, this is something that you definitely want to check into. Always check your hospital policy and what you're allowed to do. And you want to completely enclose this dressing. So all 4 sides should have tape on them. All right, once that's down, I'm going to take off my gloves because I don't want to stick my dirty hands into my pocket, even if, they're not visibly dirty or you don't think they're that dirty. You want to make sure you're putting clean hands in your pocket in order to get your tape. And please don't write on your patients, write on the tape itself. So here I'm going to write my initials, I'm going to write the date and the time. And then I'm going to make sure to clean up, ask my patient if they need anything, wash my hands again, and go document. Let's make sure I didn't forget anything that I wanted to talk about. Nope. All right, if you have any questions, email me or make an appointment with me for a Zoom conference. Hope to see you guys soon. Bye.